everybody, and welcome to the program. I'm your host, Donna Terrell. The Centers for Disease Control and Prevention estimates that 1 to 1.2 million U.S. residents are living with HIV infection or AIDS. About a quarter of them don't even know they have it. Now, since its diagnosis in 1981, that was over 30 years ago, people can live a quality life with HIV. We will talk about the importance of maintaining your health, getting tested, prevention, and other issues. Joining me are my guests, Mrs. Portia Knowlton, Executive Director of the Arkansas AIDS Foundation, Dr. Naveen Patil, Medical Director of the HIV STD Hepatitis Program at the Arkansas Department of Health, and Cornelius Mabin, Chief Operating Officer for the Living Affected Corporation and co-chair of the Arkansas HIV Planning Group. It certainly is good to have you all here talking about such an important topic that, my goodness, that was 30 years ago that it was first diagnosed. And a lot has changed, but so many other things have stayed the same. So to start things out, because I never like to take for granted that people know, that they're really aware of everything. So let's explain the difference between HIV and AIDS. Who wants to take that? Dr. Patil?
The difference between HIV and AIDS is a medical term. So if a person who's affected by the HIV virus develops certain types of diseases like tuberculosis or certain types of cancer, or when their CD4 count, that is the cells that respond to our immune system which the HIV infects, if that cells number fall below 200, they are given a diagnosis of AIDS.
Okay.
So all HIV patients are HIV positive, but not all HIV patients have an AIDS diagnosis.
Okay, so there's the, what I remember the term full-blown AIDS, meaning you have AIDS, and then there's HIV positive, meaning you have the virus that can turn into AIDS. All right, so where are we in the state of Arkansas in terms of the infection rate? High, low, in the middle? Where are we? What are you seeing?
Most of the southern states, southeastern states in the U.S. are disproportionately infected because of poverty, lack of education and all. So last year we had approximately about 340 cases, of which about 60% were initially diagnosed with AIDS. So their first time diagnosis itself was AIDS. So they've had disease for a long time.
Okay, when you mention the southern states, lack of education, that worries me. Where are we missing the boat here? Why aren't people getting the information that they need?
But I don't think we quite totally determined that. I think each year we continue to reassess and try to drill down to figure out why messaging is not getting there. There have been many campaigns. There are plenty of now social media campaigns have been put in place. So we're continuing always to reevaluate, to reassess as to how we can message, especially to younger people. So we've got to continue that in that vein, and we've got to try to do everything we can to go where those young people are, whether it's, again, the mobile social media type of individuals, billboards, whatever it's going to take. We've got to continue that track of trying to
Social
educate.
media, you mentioned social media.
Yes.
That's one of the best ways to get to young people. Now, speaking of which, you mentioned young people. So are we seeing most of the new infections in young people?
Ages 13 through 24.
13 to 24?
Yes.
13. How does someone 13 years old get HIV, become HIV positive?
Honestly, since I've been working at the foundation, the stories that I've heard, you know, just dealing with someone, trusting someone, thinking that it's okay to become sexually active at such a young age, and not knowing the true meaning behind sex, what comes with it, the territory. So I think that's where it starts, you know, just trusting someone, thinking that it's okay to have unprotected sex.
Okay, well then let's be real here, because okay, when you mention that and you say trusting someone, I think of a young girl trusting a guy. But okay, so are we talking a young 13-year-old having sex with another 13-year-old, or are we talking about a 13-year-old girl having sex with a 20-year-old?
9 times out of 10, it's like that, the 20-year-old or 18-year-old, someone that's older who's more experienced and really knows about sex.
Okay, now let's get to the nuts and bolts of this when we talk about these young people who are contracting AIDS, and let's go now to the 20-year-old, the 18 or the 20-year-old, and talk about men in particular, how are they getting AIDS? Do they know they have AIDS when they're having sex with, you know, a 13-year-old or anyone for that matter? Do they know that they're HIV positive?
Well, we want to make sure we make the distinction, of course, that many of those individuals are HIV positive.
Okay.
Yes.
First of all, we make that
Granted.
distinction,
Okay.
and that some of us who may have, you know, gotten to the age thresholds, but for the most part, they are not necessarily disclosing their status. And so those individuals who are younger, as she said, perhaps trusting or whatever, or there could be a myriad of reasons why that they're engaging in unprotected sex. But the ultimate thing is the person is not disclosing their status to that individual.
And
that's where there's a problem.
oftentimes they know their status. I was reading, you and I had this conversation earlier. It's estimated 6,000 Arkansans are HIV positive, right? 6,000 are
Yes.
HIV positive, and they are not taking any kind of medication.
That's what we call not linked to care. That's what that means.
We have, according to our data that we have, you know, since last 30 years, we've had about 8,000 cases, of which the number of people who are currently living is about 5,500. And the estimate is around about 50% are not linked to care. And going back to the question about you know, young people getting infected, there are a few things that we need to be aware of. You know, approximately from 14 to 25, about 28% are infected of our, and then from 25 to 34 is another 28%. So of our HIV/AIDS cases, about 56 or 60% fall between the 14 to 35 age group. And the other thing to, you know, people have a misconception about sex. When we say sex, it includes oral sex, vaginal sex, and anal sex. So all three can transmit HIV. Not only HIV, any sexually transmitted disease can be can be contracted by these modes of sex.
Okay, so it doesn't just have to be, well, you mentioned oral sex, and I think a lot of people, there is a belief that you cannot get AIDS through oral sex.
Yes.
You say that's not true.
Yeah, that's not only, you know, HIV, but, you know, any sexually transmitted diseases can be transmitted through oral sex.
Okay.
It's highly, for men who have sex with men, or anal sex is much higher because, you know, the mucosa of the the anal is
And
very
the
sensitive.
tearing
Yes,
of the skin and
that is
exposure.
because of that they have a higher incidence.
Okay, okay. Let's get back to, and I don't want to confuse people when I say 6,000 people, because there are more than 6,000 people with HIV who are HIV positive or have AIDS in the state of Arkansas, but we're talking 6,000 people who knowingly are HIV positive and they refuse treatment.
Yes.
I don't understand if you are told, you've been given a diagnosis that you're HIV positive and you can be treated for this and live a normal life, and you refuse treatment, or you decide, I'm not going to do that. What would make a person
But we have to look at the social determinants also. When you're dealing with someone perhaps who are dealing with housing issues or employment issues or other economic issues, none of those take precedence as opposed to your sexual health. I mean, if you don't have anywhere to live, that's going to be your priority, not necessarily trying to take care of your sexual health. If you're trying to, you know, make money or increase your, you know, access to food or things of those nature, it depends on your social determinants. And we know that is a part of the problem, that those things are prioritized first a lot of time before you're even thinking about doctors or pills or what's going on with you. So if you are homeless, that's going to be your priority, is to find shelter.
But there are some cases too where people are just nervous about family members finding out, because I had one case, this young man, he wanted to come in and get tested, and his main concern was, if I test positive, do I have to accept treatment? I said, well, that's something that you would really want to do to have a long, more fulfilled life. And he said, well, I'm living with my mother. I don't want her to find out, and she might find my medications or something like that. I'd rather her not find out. So I think it's more of people knowing that they're living with it. A stigma, yes. So it's a lot to go, exactly what Mr. Cornelius said, with people trying to find a job where they're living, but also people knowing about their status.
But things have changed in the last 30 years. You know, 30 years ago, when someone was diagnosed with HIV or AIDS, it was kind of a death knell. But right now, we have such great treatments. There are actually 4 single pill regimens. There's one pill that person, 4 different options where people can just take 1 pill a day if they are eligible, depending on their virus, and they can take that 1 pill and lead a normal life. Now, surprisingly, we are talking about HIV and aging, the elderly. People are getting 50s and 60s and older, and we are talking about not HIV for them, because even though the HIV, we are talking about aging and heart disease, aging and memory issues, those kind of problems, rather than HIV, because people are living longer with treatment. So if they take treatment and comply with treatment, they will lead a basically normal lifespan. Most people do not or will not die of HIV or AIDS.
And I guess that's the thing that confuses me. And I get what you're saying, Cornelius, when you talk about, someone who's homeless is more concerned about where I have to live and that sort of thing. But I'm thinking that when we talk HIV positive, we're not just talking about homeless people.
No, we're not.
We're talking about people who have homes and have jobs,
correct. You're
and they
correct.
still refuse to take the medication. And that is beyond me in terms of my comprehension.
Yeah. Well, it's a sense of denial.
Yes.
I think, again, once a person gets that diagnosis, they have to unpack that and figure out, again, whether the family dynamics, we've got cultural dynamics going on there. We've got individuals who just are complacent, and non-compliant. So, I mean, the list is endless. And again, in our work, we're continuously trying to find out what exactly do we have to do to get people to link to care, again, messaging, trying to make them understand that, again, we know that it's not necessarily a death sentence as it was many years ago. We have so many breakthroughs, so many wonderful medications. We have access to health care now that we didn't have all those years ago. So there's so much breakthrough that's happened, but we're still trying to get to why people are not necessarily linking to care and staying in care, which is more important. Staying in care.
And sometimes it's as simple. Some people just don't like taking medication.
That's true.
Sometimes it's just that simple.
Just that simple.
Although that's not a good reason, but it's just that simple. Knowing what we know, and like you said, there are now 4 medications where all you have to do is take 1 pill a day. So if one doesn't work for you, then you can try a different one, and a different one, just depending on your chemical makeup in terms of what works best for you. Knowing this, after 30 years, you can now live with HIV. Why should we fear it? Of course, you and I were talking about this.
Yes,
no
we
one
were.
wants to be sick, okay? No. But you can live a full, normal life with HIV. So why should we be so afraid of it now?
Well, go ahead.
The stigma is still attached to it. Like we were stating earlier, no one wants to be classified as having HIV because people are still going to look at you as, oh my goodness, I don't want to be around you. But in reality, I don't know, every day you interact with people. You don't know their status. So when you find out an individual status, why should you treat them any differently? Because like I said, you meet people every day and you do not know what's going on internally. So I really feel like people need to step outside the box and kind of overlook these things, because we just need to come together and realize one day, hopefully there will be a cure. And I really do hope for that.
One of the other things that we need to emphasize is interventions, early interventions. People do not get HIV all of a sudden. Many of them have a history of having sexually transmitted diseases like syphilis, chlamydia, or gonococcal disease. When they have that disease, these diseases, the chance of getting HIV is 2 to 5-fold higher.
I wondered about that.
So when people are diagnosed with that, it's an opportunity for us to counsel and guide them about safe sex, prevention, those kind of messages. If they are gotten across easily, we might see a changing scenario in HIV.
Did you have something you wanted to add to that?
Again, to his point, we've got to deal with behavior. And interventions are designed to try to deal with behavior, to change behavior. We've got to continue to deal with homophobia. We've got to continue to deal with the stigma around it, and to make people realize that even if you do test positive, there is a reason to live. You can live. We have, again, as we said, so many remarkable things for you to access. So there's counseling, and there's all kinds of focus groups. There's all kinds of support groups. So we've got a lot to crow about as far as I'm concerned as far as HIV.
I want to talk a little bit about the Arkansas AIDS Foundation and what the foundation offers people. We were talking about this earlier, and you mentioned the Hooper program, MAPS, or Hopper, I'm sorry, I wrote it down wrong, MAPS and CANS. What exactly are these programs, and how do they help people who are HIV positive?
Yes, ma'am. Yeah, HOPWA is the Housing Opportunity Persons with AIDS. It's federally funded. It's through a grant where we can help individuals that need assistance with rental. If they're in like the lower poverty, we can help with their utility assistance, mortgage, things of that nature, where if they come at a hard time, we're there to help them get back on their feet. With the MAPS, that's through, we have to fundraise through that. We have our AIDS Walk and our Simply Red and Wine and Cheese events to help us fundraise for clients that don't meet the criteria for HOPWA.
But still need help.
They still need help. And for our CANS, that's for our clients, which is Client Assistant Services. Client Assisted Nutritional Services.
Okay.
We help our clients come in 4 times out of the year to get food cards, and that's through a Broadway Care grant.
Okay.
And for our MAPS, that's Medical Assistant Program Services. Want to make sure you know that.
Yeah, okay. Yeah, you offer a lot of services, and I thought it was interesting too because, you know, there are places you can go to get help. You know, once you learn that you're HIV positive.
Yes.
But sometimes, and you mentioned yourself, the stigma attached to it, it's still there. So how does a person feel comfortable walking through the door for these services when they, A, don't even want to take the medication because they don't want people to know they're HIV positive, and now they're going to walk into a facility that offers support for someone who's HIV positive or has AIDS, and now the whole world's going to know that they're infected?
Not everyone is going to just think when you walk through the doors. There are, like, we go back to the stigma thing. Sometimes people, okay, you're going to that agency. Do you have HIV? I work for the agency. I'm not HIV positive. It's a passion behind it. Realizing that as a company, as Arkansas, we have to stand together. Yeah. And, like, it starts with a simple phone call. I had a young lady, she said, I really want to come talk to you guys. I just found out that I'm HIV positive. She's a college student. She came in, she talked to us, and I let her see by talking to different clients that were willing to disclose their status to her. This is the age that this person is at now. Look at their age, totally 2 different ages. And she saw that, okay, I can live with this virus and I'll have a fulfilled life.
Let me ask you, she's HIV positive, college student. How did she get AIDS? Was she able to tell you?
Well,
how she ended up HIV positive?
Yes, she contracted by sleeping with a heterosexual male. And they had sex, and I guess they slept unprotected, or no, she told me that I think the condom broke.
Okay. We talk a lot about sexual intercourse or transmitting this disease sexually, but that's not the only thing that's happening out here.
No.
People are sharing needles. In this day and age, they're still sharing needles. For drug use.
For drug use, yes, very much so. And we have to be aware of the fact that that is still happening, and to be ready to answer that particular situation, especially around hepatitis C and things of that nature. So yes, it's still happening, and we can't act as if it's not. We know people that are still using those and using needles. I've talked to a father who's very concerned about his daughter and her needle use, but he's trying to get educated about it and to try to also educate her about it. And he's doing what he can as a father because he didn't really know. But now that now that he knows, he's trying to get educated and trying to also educate her about what needs to be done.
Well, bless his heart for wanting to do that. I mean, he loves his daughter. He wants to help her before she ends up being one of the people we're talking about here. One of the things, Dr. Patil, you told me that I thought was refreshing to hear is another pill, but there is a pill that you can take if you are living with a person or married to a person who's HIV positive. You can take this pill and you can protect yourself against infection.
Sure, yeah. That is known as PrEP or pre-exposure prophylaxis.
Yeah.
So basically this is for people where one of their partners, loved ones, is HIV positive and one of the partners isn't. There are other high-risk groups where you've had sex with a man in the last 6 months or IV drug abuse. There are different groups who also can take these. But basically it's for someone one of whom is HIV positive, one is HIV negative. And if they take this pill, and these pills are some of the same pills that are used to treat HIV. So if they use one of these pills daily and consistently, the chances of them getting HIV from their partner is minimal.
Significantly reduced.
Significantly low. And a word of caution, apart from the pill, is also suggested that they have other barrier precautions like condoms and other modes to prevent.
Okay.
So it's been there out for a couple of years now, and I know many people are opting for it.
We also need to talk about hepatitis C, and you were very adamant about this, is many of the people who are infected, there's a percentage, a pretty large percent of people who end up HIV positive also have hepatitis C.
Yes, ma'am. So HIV patients who use IV drugs, are injection drug users, they have an 80% chance that they are co-infected with hepatitis C virus. Overall, HIV patients, there's a 25% of HIV patients who are hepatitis C co-infected. And the good thing about this is now we have a cure for hepatitis C, and people can be treated for about 12 or 24 weeks and can be cured of the disease.
Hopefully one day we'll have a cure for AIDS also. Cornelius, I need to ask you this question because I know you've been leading the charge for a long, long time. We were talking about this before. You see this disease, this is a people's disease. It's not a gay person's disease. Right. It's not, I mean, we can attach labels to it, but we should not, because just like you said, the young college girl who came in, female, heterosexual, she had sex with a heterosexual male, at least she thought that, and she ended up getting AIDS. But Cornelius, I guess in saying all that, you've been dealing with this for so long. What is the thing that frustrates you the most in trying to help people?
Well, I guess ultimately it's, again, trying to find the correct message, and also where to deploy that message. We're over the 30 years, we've experimented with many, many, many ways of messaging, and so we're continuing to try to find what is the best message, how to coin that message, and where to deploy that message. We love the fact that we have social media that takes to wide berths, but again, finding the right message. I think the one thing that I try to continue to encourage people is that we want to try to take the stigma out of HIV. We also want to encourage people to understand about PrEP and the fact that it is there for you. I try to encourage people about the Affordable Care Act and that it is available to you.
Explain that.
Well, the Affordable Care Act is, of course, the insurance plan that you can actually, enroll in an open marketplace, pretty much so. We have many individuals who are on the Ryan White program who are migrating to their ACA because they get a better quality of health care there. You get essential health benefits, you get to go to the doctor more. Again, it increases your quality of life. So, I keep trying to really talk about all the positive aspects that are available to individuals living with HIV or AIDS and those who perhaps are newly diagnosed. So we just kind of continue to message around that, to give a positive spin about it, and to let people know they have reasons to live, regardless to what your circumstances are.
We talk about the stigma, but let's be real. With the number of HIV-infected people out there, should someone who's not HIV infected and they meet someone and like this person, fall in love with this person, should they fear being with that person?
No, I don't think
it's something to think about.
It's something to think about, but we always encourage, that if you are going to engage with an individual, that you can certainly get tested together. Yes. I certainly encourage women, especially black women, to be sure and be open and honest with your partner, and to perhaps get tested together so you will know basically where you stand. Encourage condom use. There's female condom uses you can use also. So there's many, many ways that you can be responsible for your sexual health.
Okay.
And that's where I come from the standpoint of that about it being about people, because HIV doesn't know any particular population. You know, and it's an infection that is in, you know, young people, older people, men, women, black and white. So we have to make sure that we message across the board that everyone is responsible for their sexual health.
Maybe we've already touched on this, and we're going to run out of time here in a minute, but the issue of HIV criminalization in Arkansas, what is that?
Well, we don't want to. HIV is being criminalized to the point where individuals are being prosecuted. Of course, we know for lack of disclosure, but we want to revisit that and make sure we understand that there have been new science as to that the things that people are criminalizing are actually not really transmissions. You cannot transmit through spitting at someone. You know, you can't, or sweating on them, or things of this nature. So we need to really look at that particular piece and say, look, we need to update that law and make sure we understand that we don't want to criminalize. We don't criminalize diabetes. We don't criminalize, you know, hepatitis. Cancer, or hypertension, or any other thing. So let's not criminalize HIV by saying that if you do this, you could be arrested. Right.
Any final thoughts you want to share in terms of what the foundation has to offer to people, or what you want folks to know?
And that is something also, we do offer testing there, and we want them to feel as when they do come into our office, we're not trying to put a stigma on them. We want to welcome them. We want them to know we're like a family there. We want to sit down and talk to you about HIV and AIDS because it's an issue that does need to be discussed.
Are you guys using social media also?
Yes, we do.
Okay.
We're on Facebook, Twitter. We have our own website, ArkansasAIDSFoundation.org.
Okay. Okay.
Yes.
And the Department of Health offers free testing for HIV, some sexually transmitted diseases, and hepatitis C.
Okay.
So we can suggest know now whether you're positive.
There are places to go where you can get help, you can get information, and know your status.
That's correct.
Bottom line. Thank you so much for being here. I certainly do hope we gave people some information that can help them, or at least give them some resources and food for thought.
Right.
And that's going to do it for us. Thank you for joining us, and you have a good afternoon.